Welcome to Theoretical Foundations of Nursing Practice. Before you start this PowerPoint presentation, I really want to encourage you to follow the link on the Moodle shell underneath the Chapter 5 PowerPoint Notes handout called Nurses Change Lives. I think this video is incredible for showing how nurses throughout history have brought such incredible innovation to patient care and how nurses have profoundly changed human health. So first of all, what is theory? So in order to understand this definition of theory, I just want to break down two of the terms that are used in this definition. So concept is a thought or idea, and a phenomena is a fact or situation that is observed to exist and to happen. So theory is basically a set of assumptions or propositions that identify the relationships between concepts. So identifying the relationships between different thoughts and ideas. And being able to explain, predict, and prescribe different situations that are known to happen. So when we take that foundational definition of theory, which is identification of relationships between thoughts or ideas, and being able to explain a situation or event that is observed or known to happen and put that into the nursing profession, we get nursing theory. And this is knowledge about nursing organized for nurses to use in a professional and accountable manner. It allows nurses to have a perspective for viewing clients' situations, a way to organize their data, and a method for analyzing and interpreting information, and then being able to render this into a nursing practice that is coherent and informed. So Florence Nightingale's work is actually considered an early theoretical and conceptual model for nursing. And this model for nursing is described as a descriptive theory, which provides nurses with a way to think about nursing practice in a frame of reference that focuses on patients and the environment. So when we go back to our definition of theory, which is a purposeful set of assumptions or propositions that identify the relationships between concepts, and we think of the model for nursing, the two concepts in the model for nursing are patients and the environment. Florence Nightingale's work was well known for infection control, sanitary practice, and hand hygiene. So this model for nursing describes the relationships between patients and their environment. Ultimately, nursing theory and nursing science provide such a unique body of knowledge about the nursing practice. So the table on this slide is directly from your textbook, and it just explores the common terminology that's used when we talk about scientific theorizing. Because a lot of these definitions are quite complex, unfortunately. But some of the ones that I want to highlight on here are first the concept, which we've already talked about as being a thought or idea. And just a reminder that concepts are the building blocks of theory. So they're the primary elements of a theory. And then a theory takes those concepts and describes or explains them in a systematic way. I also wanted to highlight the term proposition, and this is a statement of a relationship between concepts. So this would be saying, for example, clients who receive appropriate nursing care have better health outcomes. So the two concepts of that proposition are appropriate nursing care and better health outcomes, and you're creating a relationship between them. And the final definition I wanted to explore on this table is a conceptual framework. And a conceptual framework is a structure that links together concepts and propositions for a specific purpose. So later on in this presentation, we're going to look at the metaparadigm concepts, and that will be an example of a conceptual framework. So there's 4 types of nursing theory that we are going to focus on for this presentation. And the first one is a grand theory. And grand nursing theories have the broadest scope and present general concepts and propositions. So theories at this level may both reflect and provide insights useful for practice, but they're not designed to be tested. These theories are generally very abstract. So, for example, a grand theory might explore human behavior, which is quite an abstract concept. Next is middle range theories, and middle range nursing theories are narrower in scope than grand theories, and they offer an effective bridge between grand nursing theories and nursing practice. Next, we have descriptive theories, and descriptive nursing theories describe phenomena. So they speculate on why certain situations occur and then describe why those things happen. And finally, we have prescriptive nursing theory, and prescriptive nursing theory predicts the consequence of a specific intervention. So basically, prescriptive theories are action-orientated, so they test the validity and predictability of a nursing intervention. So this is the conceptual framework that I had hinted at earlier in the presentation, and these are the metaparadigm concepts of nursing. And so nursing has 4 basic concepts. Person, who is the recipient of nursing care, and this can include individuals, patients, groups, families, and communities. Then there's health, which is defined as the degree of wellness or well-being that the client experiences. Environment, which is the internal and external surroundings that might affect a patient. And then we have nursing, and this is the attributes, characteristics, and actions of the nurse that is providing care on behalf or in conjunction with the patient. And so this metaparadigm concepts conceptual framework shows how all of these concepts interact with each other and the relationships between each of them. So there's several ways of knowing in the nursing profession, and ways of knowing refers to patterns of knowledge application and nursing practice. So science is just one form of knowledge in the nursing profession. So there's 6 ways of knowing total that are identified in nursing practice, and these ways of knowing describe how nurses know what they know. So empirical science is the information that is gained through theories and observation. It's the factual and descriptive evidence of the nursing practice. Ethical way of knowing is right versus wrong. And this is you're asking yourself in a nursing situation if the actions are right and are they just. Personal way of knowing is knowing who you are as a person and as a nurse. So this comes through a lot of self-reflection. The aesthetic way of knowing is your art in nursing, and this is an example of this would be your ability to be empathetic with patients. And sociopolitical knowledge is understanding the sociopolitical influences in nursing. So in sociopolitical way of knowing, nurses must critique on how sociopolitical factors affect the health of a person and the community. And finally, critical thinking, which we kind of just explored in our last lecture, and this includes the analysis and evaluation to form a judgment on something. So nursing diagnosis is actually an interesting example of how nursing theory has kind of evolved and grown over time. So when the nursing process was first developed, it was just a conceptual framework that focused on how to assess and interpret data for individual patient situations. But the conceptual models were less explicit on how to plan, implement, and evaluate nursing care. So in order to fill this gap, nursing diagnosis became an additional phase in the nursing process. So it is what we know it to be today, which is ADPI. So that includes your assessment, diagnosis, planning, implementation, and evaluation. However, to make sure that there was consensus across the board on the nursing diagnoses that were being used in nursing practice, This is where NANDA became a big thing. And so NANDA stands for North American Nursing Diagnosis Association, and they provide a list of common patient problems that are addressed by nursing practices. Advantages of this list is that it provides a common consensus and common language to be used by nurses so that all nurses can kind of be on the same page. So if one nurse says this patient's at risk for falls, the other nurse can understand what's going to be involved in that plan of care. However, the disadvantages of this list is that it can be kind of limiting. So here we have listed the major theoretical models that are used in nursing practice. So the first being practice-based theories. And practice-based theories are situation-specific theories that are narrow in scope and focus on the specific patient population at a specific time. So practice-based theories provide a framework for nursing interventions and suggest the outcomes or the effect on nursing practice. So a theorist in this theory would be Florence Nightingale. Because of her time during the Crimean War, she outlined the principles of nursing practice that include the importance of acknowledging the environment. And this included things such as clean living areas, fresh air, and the presence of light. We also have Dr. Moira Allen, who developed the McGill model. And the McGill model was a focus on health rather than illness and treatment, and on family members rather than just the patient alone, and on family goals rather than on the nurses, and on the family's strengths rather than their deficits. Needs theories focus on conceptualizing the patient as representing a collection of needs. So for example, Virginia Henderson conceptualized a patient as a compilation of 14 basic human needs, and they included to breathe, eat and drink, eliminate waste products, move and maintain posture, rest and sleep, dress and undress, and maintain body temperature, be clean, avoid danger, communicate, worship, work, play, and learn. So by viewing a patient in this way, it clearly defined the nurse's role to help the patient meet these needs. We also have Dorothea Oram, who contributed to the needs theories, and her theory was the self-care theory. And her work addressed the ways in which people were responsible for meeting the following universal self-care requisites, and they included maintaining sufficient intake of air, water, and food, maintaining a balance between activity and rest, between solitude and interaction, providing for elimination processes, preventing hazards of life, functioning, and well-being, and promoting functioning and growth in social groups in accordance to human potential. Oram also acknowledged that the effects of multiple lifestyle factors such as smoking, diet, and exercise could impact patients' health, and that it was a nurse's responsibility to help care for those patients and their needs. Interactionist theories focused on the relationships between nurses and their clients. So Piplau is a common nursing theorist in this type of theory, and she defined the core of nursing care as the interpersonal relationship between the nurse and the patient. So basically the relationship between nurses and their patients. Piplau defined the nurse as an investigator, a prober, an interpreter, and a reporter. And using the data that they extract from the patient, they're able to develop insights and meaning to the patient's behavior and then help the patient recognize and change the patterns that obstruct achievement towards their goals. Next is systems theories. And the main appeal of systems theories is that they account for the whole of an entity, which would be the system, and its component parts, which would be subsystems, and it accounts for the complex interactions between the parts and the whole. Betty Newman's approach to theorizing about nursing and systems is probably one of the more common and well-recognized ones, and Newman understood the person, or a patient, a person in general, to be a physiological, psychological, sociocultural development, and spiritual being. So she looked at as a patient as having each of those systems as part of a whole person. Finally, simultaneity theories compared to systems theories focuses not on the subsystems, but the systems that make a person a whole. So they focus on the person actually being one. So they view an individual as an entirely irreducible whole, inherently and holographically connected with the universal environment. And the most common theorist in this group of theories is probably Jean Watson. And Watson believed that nurses must do far more than deal with just physical illness. They must attend to their primary function, which is caring. And so Jean Watson's caring model is that caring infuses all aspects of the nursing role and draws attention to nursing acts that embody the aesthetic that facilitates both healing and growth. So basically, patients couldn't heal without caring. So throughout this PowerPoint, we've kind of explored where nursing theory has been, where it's come from, and so what does this mean for theorizing into the future of nursing practice? And this is to stimulate your thinking on nursing. It's to create a broad understanding of the science and practice of the nursing discipline, which is so unique. And it provides a rationale for nursing actions and decisions. Theory provides a way of creating new ideas about the discipline of nursing, and it brings the old and familiar concepts of nursing together and shapes them into a bold and exciting new way of looking at the profession. So while nursing theory can be a bit dry at times, I will not argue that, it's actually quite interesting to see how the nursing profession has been able to grow over time.